Advocating for healthcare reform in the United States requires a multifaceted approach that involves raising awareness, mobilizing support, and engaging policymakers. Here are some steps you can take to advocate for healthcare reform. Educate yourself. Start by educating yourself about the current state of the healthcare system in the U.S., including its strengths, weaknesses, and areas for improvement. Learn about different proposals for healthcare reform, including universal healthcare, single-payer systems, and public options, and their potential implications. Identify key issues. Identify specific healthcare issues or challenges that you are passionate about and want to address through advocacy efforts. This could include issues such as access to affordable healthcare, rising healthcare costs, prescription drug pricing, coverage for pre-existing conditions, or disparities in healthcare access and outcomes. Build coalitions. Collaborate with like-minded individuals, organizations, advocacy groups, and healthcare professionals who share your concerns and goals for healthcare reform. Join or support grassroots movements, advocacy campaigns, and coalitions working to advance healthcare reform at the local, state, or national level. Raise awareness. Raise awareness about healthcare issues and the need for reform by engaging in public outreach and education efforts. Use social media, blogs, op-eds, letters to the editor, and public events to share information, personal stories, and data about the impact of healthcare policies on individuals and communities. Mobilize support. Mobilize support for healthcare reform by organizing petitions, letter-writing campaigns, phone banks, rallies, marches, and other advocacy events. Encourage friends, family members, colleagues, and community members to get involved and take action to support healthcare reform efforts. Engage policymakers. Advocate for healthcare reform by engaging with elected officials, policymakers, and government agencies at the local, state, and federal levels. Write letters, emails, or phone calls to your representatives expressing your views on healthcare issues and urging them to support specific reform measures or legislation. Participate in advocacy campaigns. Support advocacy campaigns and initiatives led by healthcare advocacy organizations, patient advocacy groups, professional associations, and grassroots movements working to advance healthcare reform. Take action on specific advocacy campaigns by signing petitions, attending town hall meetings, or participating in advocacy days or lobby days. Support policy proposals. Support specific policy proposals or legislative initiatives that align with your priorities and goals for healthcare reform. Stay informed about proposed legislation related to healthcare and advocate for policies that expand access to affordable healthcare, improve quality of care, and address healthcare disparities. Stay informed and engaged. Stay informed about developments in healthcare policy and advocacy efforts by following news updates, subscribing to newsletters, and participating in online forums and discussions. Stay engaged with advocacy organizations and networks that are working to advance healthcare reform and continue to advocate for change. Persist and persevere. Advocating for healthcare reform is a long-term effort that requires persistence, perseverance, and resilience. Stay committed to your goals and continue to advocate for change, even in the face of challenges or setbacks. Celebrate victories, learn from setbacks, and remain steadfast in your commitment to improving healthcare for all. By taking these steps and actively advocating for healthcare reform, you can contribute to efforts to create a more equitable, accessible, and sustainable healthcare system in the United States. Your advocacy efforts can make a difference in shaping healthcare policy and improving the health and well-being of individuals and communities across the country.